Hello doctors. So today we have a 39-year-old man, a battery attendant, who suddenly developed weakness, loss of appetite, non-localized colicky abdominal pains and nausea. Objectively his skin is grey, there is a pink-grey stripe on his gums, the stomach is soft and sharply painful. Blood test detects erythrocyte with basophilic stippling and anemia. The patient has a history of peptic ulcer disease of the stomach. Constipation tends to occur every 3 to 4 days. What is most likely provisional diagnosis? Now there are many hints in the question regarding the diagnosis. First hint is the occupation. He is a battery attendant, so he is exposed to lead fumes. The second hint is actually grey color of skin and pink grey stripe on his gums. This is very typical for lead poisoning, and this is called Burton's line. Here in the image you can appreciate the greyish stripe or line near the gum, right, on the gums, and here you can appreciate the bluish lines around the teeth on the gums, right? So grayish lines is basically H2S, right? And over time lead has cumulative effect which replaces hydrogen, and there are deposits of lead sulfide where the white changes to darker color. The third hint here is about the basophilic stippling of the erythrocytes. Now please remember, the word basophilic stippling is not related to basophils. It is related to basophilic staining of the RBCs. And what causes that staining? Nucleic acid. And we can clearly appreciate nucleated RBCs in the image, right? Now another and the most important hint in the question is actually anemia. So we can see here that lead inhibits the incorporation of the Fe to the heme, iron into the heme, which causes accumulation of iron, right? And there are formation of inclusion bodies like these, which are called siderocytes. Now we need to remember three very important biochemicals that are excreted during the lead toxicity. The first one being delta amino libulinic acid, also called as ALA, delta ALA or 5-ALA. Okay. The second one is coproporphyrin. Alright. These two have been asked several times in Krok. And I want you to remember one more. That is uroporphyrin. All three markers are present in urine during the lead toxicity. Very, very important point. Looking at the questions, so you can see there were 3 questions regarding lead toxicity in a single year. Same in 17, there were 3 questions regarding lead toxicity. So you can understand it's like favorite topic of the Krok question makers. Anyway, so the first question is same as what we did right now. The second question mentions about ALA, aminolevulinic acid, and coproporphyrin. So lead toxicity. It also mentions low Hb and reticulocytosis, right? Now, the third question was a bit tricky because it only mentions about Burton's line. So that is also a very, very important point, right? Similar questions were repeated in 2017, as I said, ALA plus Cropro in second question, and the third question was about Burton's line. Thank you.